think after hearing that story, we've had no resistance to brushing because you can't, it's like one of those things that you can't unsee. I actually have a poop emoji on a stick that I have in the clinic, which I put in my big teeth. So yeah, I show them a mouth with teeth with a poop emoji in it. That's it. You can't unsee it.
Welcome to the Protrusive Dental Podcast, the forward-thinking podcast for dental professionals. Join us as we discuss hot topics in dentistry, clinical tips, continuing education, and adding value to your life and career. With your host, Jazz Gulati.
Hello everyone and welcome to another episode of Protrusive Dental Podcast. I'm your host Jazz Gulati. This is going to be an epic two-part episode with Dr. Libi Almuzian, who is just one of the nicest people in dentistry. She is a fantastic pediatric dentist and she has some great gems to share with us all. In the first episode, we talk about real-world clinical dilemmas for GDPs because seeing children is not everyone's forte, let's admit it. Some of us are better than others at seeing children. So I think what Dr. Libi shares with us will really help everyone, not only those who already love seeing children, because she has some great little tips and tricks that she shares, which allows you to build better rapport with the child and the parents. But also, it gives you, if you're not fond of children or you don't like seeing children in practice, but you have to see children, how can you make your visit better? How can you make the patient experience for the child in front of you better and for their parent? So we're going to talk clinical and also very much non-clinical, cooperation, communication. We're going to talk about how to manage the child patient with multiple caries lesions, and how to actually, more importantly for me, I found it difficult not to manage the actual dentistry, but to actually manage the parent. Because a lot of time you take bite wings for the first time and you may find significant amounts of tooth decay which the parent had no idea about, and to try and break that news to a switched on parent can be quite difficult. And sometimes you're managing the parent's emotions and not just the child. So we're going to talk about that. Do you have a way in which you communicate caries with your child patient? Do you just say, oh, it's a hole, it's a cavity, you have bugs on your teeth and they ate your enamel away? I mean, how do you actually communicate caries to a child, right? Well, I think this is the biggest takeaway amongst many takeaways from this two-part episode, and this is Dr. Libi's sugar bug story. So if you struggle or you want a better way to communicate caries to a child and a parent in a playful manner, then I love what Dr. Libi has shared with us about the sugar bug story. So I'm really excited for you to hear it. In terms of Protrusive Dental Pearl, I have to do a shout out to one of my listeners who messaged me. I believe they live in Edinburgh. I don't know their name, but they kindly messaged me and gave me a tip. The Instagram handle is Bohem Gravities. The tip they have, which is relevant to managing children, is that they have a small Lego man somewhere in the surgery, somewhere where the parents and the child can find it. And you tell the child and the parent that I want you to try and find this Lego man that's hidden somewhere. And what it allows is, in their own words, 2 minutes of peace and quiet while the child and the parents are having this little game around the dental room, around your surgery, where they're looking for this little Lego man. And it actually it works really well for them. And I think it's a great little pearl. So I think, buy a little toy or a little Lego man, stick it somewhere slightly hidden, but you can still see it from where you are in the dental surgery, in the dental chair, and play a little game. So it gives you some peace and quiet and gives them something to do so that they're not all going too loud and rowdy in your dental chair. So thank you so much for sharing that little Protrusive Dental Pearl with the listeners. I really appreciate you reaching out for that. Guys, enjoy the episode, the two-part episode of myself and Libby. I'll do another intro for the second episode. It was, just the amount of value that Dr. Libby was providing. I had to split it into two episodes, so lots of great content in there. I do realize that by the time you're listening to this episode, it will probably be the peak of COVID-19. I hope it peaks and the peak finishes ASAP, to be honest with you. I just hope wherever you are, wherever you're listening to this from, you are safe, your family is safe and well, and you try and stay positive, stay distracted away from all the terrible things happening in the news, and I wish you and your family all the best. Enjoy the episode. I hope you learned something from it. Dr. Libi Almuzian, thank you so much for coming on the Protrusive Dental Podcast. You are a dear friend of mine and my wife's. Obviously, you and Dr. Mo Almuzian, who came on, I don't know which episode it was, must have been episode 4 or 5, the orthodontic one. So you're going to do, very kindly, the PEDS version, PEDS 101, PEDS 201. We're going to really, the aim of this episode, Libby, is to help GDPs become better at managing the child patient. I'm going to give you my crappy introduction, and then I'm going to let you do
a better one. So to me, you are someone who is an amazing pediatric dentist. You share so much on your Facebook and Instagram channels, helping GDPs. You're also helping a lot of orthodontists in terms of managing the ortho pediatric cases. And I feel as though you're super mum. I know you're a super mum. I've met your 3 lovely daughters. So that's my crappy introduction for you. Please, Libby, can you tell the world listening? Because actually now I can tell my listeners that 94 countries listen to my podcast as it stands. So can you tell the world? Can you tell the world a bit about yourself?
So it's a pleasure to be on your podcast. Thank you very much. I'm a pediatric dentist. I recently completed a clinical doctorate in clinical dentistry in pediatric dentistry. And I'm just really passionate about pediatric dentistry and everything about it. And I just want to make everyone better at treating children for the greater good. So I think it's something that can be done really well. And it just needs, a few hints and tricks and tips for dentists to be able to do a great job. So I'm really excited to share what I can today to help everyone, really. And that's the purpose of my pages, really, on Instagram and Facebook, are just to just bring to light all the information that parents are maybe missing and are maybe misled in the media at the moment. And from, a consumer point of view, lots of the advertising is aimed towards parents, and it kind of guilts them into buying things that maybe have hidden dangers. So just raising lots of awareness is our role as dentists, really.
Brilliant. As you're speaking, I'm making notes, because every time you say something like that, and I think of other questions to ask you along the way. But
oh gosh.
No, don't worry. Tell us about where you work at the moment. What kind of setting? What are the kind of children that you treat at the moment?
Yeah. So at the moment, I'm working at the Berkeley Clinic in Glasgow, and it's a private clinic. The kind of children that I see are ones who are anxious, maybe considered too young to be treated. And some of them have some medical complications, some of them have some mental complications. So just people with special needs, and just anybody who maybe hasn't gotten along with their general dentist, not for reasons, not because the general dentist isn't good enough, but it's just that their needs sort of are out with that. And that's why people specialize as pediatric dentists, because they're we've done 3 years of training, and in those 3 years you learn so much, and you just realize just how much more you can do for children. So that's my role. I really enjoy using inhalation sedation, which is one of the tools that maybe isn't available to general dentists. And I found it to be a good sort of stepping stone, sort of between actually just having treatment on the chair or having to go for a general anesthetic. There's that little bit in between where you can use inhalation sedation. And if it works, fantastic. That child doesn't have to go for general anesthetic, which is, it's not that I'm against general anesthetic. It's just that I think that teaching a child who's really anxious to be able to cope with dental treatment is an investment in their future, because nobody can avoid dental treatment their whole lives. So being able to overcome those fears is actually helping them more than putting them to sleep and just dealing with the oral health issues. So it's a more holistic approach, really.
And also, when children are put under, GA, the treatment plan becomes far more aggressive.
It's more drastic. And the reason for that is we don't want to have children going for a second general anesthetic. And this is, we're evidence-based dentists in the UK. And, it's shown that when you're not drastic in these approaches, you do end up going for a second general anesthetic. And you don't want to put that child at risk of infection after he's undergone a general anesthetic. And general anesthetic is not without risk. And it's also a very stressful and traumatic event for the child and for the parents. So you do want to try and avoid it if you can.
Well, there's 2 things worth mentioning there. One for perhaps students, because I remember being vivid as a student, and one of the questions was, what are the signs with a child that there may be neglect at home going on, or things that you are worried about the child's sort of general well-being? And one of them is actually, if they've been through a second GA, you really should be looking at what kind of care they're getting at home. So I remember that being a viable question. And the other thing is that, which I'm sure all dentists in the UK know, but for those in the world listening, unfortunately, we have a situation in the UK where, and correct me if I'm wrong and my stats are not up to date, but 1 in 3 of GA admissions for children is because of a dental reason.
Correct, yeah. So it is quite a high figure. I mean, considering all the GAs that are happening for kids, yes, a third of them are for dental issues. And while you have to take that with a pinch of salt, because some children are going in because they have buried teeth, they've got impacted teeth that need to be taken out. They've got other issues it is a kinder option when you've got a child who's 9 or 10 years old and needs all 4 of his adult molars out. Yes, it's kinder to send them in for GA because that's quite a lot to cope with at the age of 9 or 10. So that's maybe in the case of MIH or something like that. So it's not to say that that it's unreasonable that we're sending all these children for GA. Previously, these children may have had to have everything done on chair, and it might have ended up, being more traumatizing to them. But at the same time, when we're talking about decayed teeth in very young children, that's the GAs that we're trying to avoid.
Absolutely. Well, let's just dive right in because my podcast is very clinically focused, and I want the people on the front line, the GDPs, to really gain value, and that's what we're going to talk about. So let's start with managing a child with multiple caries lesions, and how do you manage the child, and how do you manage the patient, manage the parent even. So I know it's quite a broad question, and there's so many factors involved. So for example, I imagine the patient's age has a significant bearing. What their diet's like, what the education level's like. But at what point do you think, okay, this level of caries should be dealt in primary care, and this is the way it should be dealt? Or what level is, okay, you need to now refer, and just any sort of gems that you can do. And I know it's too broad of a question. I can narrow it down if you want me to. But just managing the biggest problem that we see is caries in children. And I'm going to come on to later whether when we're managing caries in general practice, should we use LA? Should we not use LA? That sort of stuff. But if you just start with the general overview of management of caries.
So overall, when you get a child in, if they're cooperative and the parent is on board, because you have to remember when you're dealing with children, it's not the same as dealing with an adult when they come in to be treated. You have to take into account the dynamic. So there's a new dynamic that's between you, the parent, and the child. So the parent has to be on board with your plan, and the child has to be cooperative for the plan, and you have to win both of them over. The biggest thing you need to think of is just empathy. So firstly, when you get a patient in, you need to empathize with the parents and, make them understand that, everybody can find themselves in this situation where their child has caries in their teeth, and that your job as a dentist is to actually help them identify the reasons why we've gotten to where we are and how to move forward. Okay, so no guilt and no blame.
Can I add something to that, Libby? Because I think that's a great starting point. So what I say to adult patients and to the parents of my child patients is I always say, look, in this practice, where we have a policy of no shame, no blame, we just want to help fix this and prevent it. And we said that from the start. And I just find that everyone just breathes a sigh of relief. And everyone's so much more relaxed. Because if you don't say that one line or put it across in the message that you've just said, then all the while, that's what the parents are thinking, that I'm a terrible mother, I'm a terrible father. And they're not really absorbing the information you're giving. So that's a great starting point. Empathize and let them off the hook. Because, what's happening, if they've got the right attitude, it may not happen again.
Exactly. And it's just that they become less defensive and more open to your suggestion. And that's what you want. So that's for the benefit of the child and the parent. And once you get the parent on board, so if your parent is not on board, the parent of the child, you will never succeed in treating that child. Because no matter what, the child will feel that parent doesn't trust the dentist, and they will not trust you either. So it's really important to gain the trust of the family. That's the first thing you need to do so you can motivate them. What I think some GDPs fall into the trap of is treating the tooth which is worst first, which I don't think is usually the way to go, because what you're going to do is if you've got a carious tooth that has the biggest hole, it needs the most amount of treatment. that's going to be quite taxing on the child. And you haven't had a chance to build a relationship with them, and you haven't had the chance to actually gain their trust. And it's a lot about trust, because you're going into a really personal space of a child, their mouth. Not many people are allowed to touch that area of their face. So usually it's only their parent or primary carer who will be touching that area. And so for them to allow you to do things that have different smells, different tastes, sounds is really difficult for them. So what you need to do is to build the trust. I would say when you assess a patient, let them play. So by let them play, I give them the high volume, low volume suction. I let them suck out some water from a cup to show them that they're allowed to touch these things when I say. So you're still being quite strict with them, so that you're setting boundaries that, you know, and you can say, right, that's enough. We're not going to play anymore. We've finished for today. Next time, once we've done X, Y, Z, then we will have another play. And that gives them a bit of a reward system, but also familiarizes them with all the tools that you're going to use. So if you grab the suction and put it straight in their mouth, and that's what you would need to do if you're doing, you know, if you're using the high speed, you know, you need to get in there with the suction. And so for them to allow you to do that, if you've let them already hold the suction and put it in their mouth themselves, that's like you've cut down the time that you have to explain to them and convince them to let you do that, and they won't jump up and shock.
Awesome. I want to highlight that as a tip. So put the suction, let them put the suction in the cup full of water, right?
Yeah, and you just introduce it. You say, oh, he's so thirsty, he likes to drink. Oh, let's give it a drink. And then later you say, oh, look how funny it feels on your hand. Oh, let's hoover your nose. Oh, why don't you stick out your tongue? It'll tickle your tongue. And you get them to put the suction into their mouth. That's it. You've crossed that barrier. They're not scared of it anymore.
That's fantastic. That is really, really good. Because what I do at the moment, and I some dentists do this, so I give them the mirror. I let them put the mirror in the mouth. I make a little balloon using the glove. But that suction one I've never come across. And I think that suction, the sound it makes can be quite scary. And some of these suctions can be really strong. So I'm definitely going to implement that Monday morning. Thank you so much.
Yeah,
so you're going to have a little play, and you've set the boundaries. I like how you set boundaries. Well, okay, playtime is over. Brilliant.
Yeah. So it's all about, you know, you have to be kind of strict with them. Otherwise, you know, they tend to overstep. Kids are like, they push boundaries. That's what they like to do. So it's just making sure that you're, you know, firm that, yes, okay, we're going to play now, but we're only going to do it 2 more times. So if they say, can we do it again? We say, okay, we're going to do it just 1 more time. But you've got to make sure that you follow through. So even if they get a little bit upset when you say, that's it, it's over, you distract them then with something else. But you make sure you don't go back on your word, because that will be key to being able to do some treatment for that child. So I always start with prevention. When I look at a full mouth of caries, if that child has their 6s through, but their baby molar, you know, deciduous molars are carious, the first thing I'm going to address, I'm going to seal those adult molars. Okay. The reason why is, first, they are most important. I need them to stick around for the longest. And second, it's a good, it's an easy enough procedure that will help them build trust. And, you know, I introduce it as, oh, it's just like getting your nails painted. Have you seen everybody gets gel nails and you put the special light on? This is exactly the same. And you can
another gem. That is so good. That is you're gonna. I'm sure gonna make a whole list of analogies after this episode. So that's another one. The gel nails. I love that.
So it's actually really funny. When I started working in this practice, the nurse my nurse Chloe is fantastic, and that's another thing. Having the same nurse, I know that it's supposed to be rotated and everything, but actually in pediatric dentistry, there's a huge benefit from having a familiar face for that patient to come in and see the same nurse each time and see the same dentist. There is a bit of value to that. So if you can do that, that's ideal. So anyway, my nurse, Chloe, had to learn all the language that I use. It's a different language, so I won't call things by their names. I won't say, pass me the high speed. I won't say, pass me, a long tapered Fisher burr. I'll say, oh, pass me the ice cream cone one. Just like, I don't want to say words.
Can you do us a favor? And like at the end, if you got like maybe a list of 15 things like to translate to help the GDP. So for example, I call the fast handpiece the Buzzy Bee, but you might call it something else.
Yeah.
I call the suction the Henry Hoover. But I think they could probably do better than that, because some kids might not know what Henry Hoover is. So if you can give us like 10 to 15 things, we'd really love that.
Oh, that would be great. I don't mind doing that.
Thank you so
You
much.
can all join me in the craziness. So anyway, back to what we would do first. We do the prevention first, and I have actually downloaded an app which allows you to make a social story. And social stories are used for children with autism, but I've found that using them with any child helps so much. So what it is I have taken photos of my own daughter coming into the dental clinic, sitting in the reception, lying on a dental chair with the suction in her mouth, sunglasses on, the light on. The next picture is me examining her teeth, then cleaning her teeth with a slow speed handpiece and brush, and then the steps for having a fissure seal. So showing the blue shampoo, which is the etchant. So we're going to put blue magic tooth fairy blue shampoo on your teeth, and it makes it really nice and clean, but then we have to wash it away. It doesn't taste nice. So we're going to hoover it away so you can't taste it, and explaining to them why you need to put cotton wool rolls. So it'll keep it dry. You explain to them why you need to use the hoover so you can hoover it away and you don't have to taste it. You explain to them you need to dry it because you can't paint your nails when they're wet. It's the same thing with teeth. You can't paint your teeth when they're wet. So we need to dry it with the air. And I use the 3-in-1. And I always, when I introduce the 3-in-1, I spray their hair first. I say, oh, I'm just going to dry your hair. Didn't you come in to get your hair done? That gets a giggle. So you're just all the time trying to do it playful. Oh no, I'll dry your ears so you can hear me. Wait a second, I'll just dry your snotty nose. That one, just like, even if they haven't laughed at the first two, they're like, oh, this is so funny. And then finally you get it into the mouth. So it's just building up that, and I'll tickle you on your neck with it. So just getting them to feel like these things are non-threatening. And also when you give a child a reason for you doing something, instead of saying, I'm going to dry your tooth, or I'm going to use the suction. If you say, I'm using the hoover so that you don't have to taste it because it doesn't taste very nice. So I want you to be comfortable. You're making them feel as if you care. And that is the bottom line. When they feel you care about them and you're doing things to help them, they will trust you and the treatment can go so much smoother. So using this social story is such a game changer for me. So if I have a patient who next time I'm going to do fissure sealants for, and I send them this story of what it looks like, what the things look like, and what the steps are, and they go home and read that with their parents once or twice, and they read it the night before. They read
it on their parents' phone? They read it on their parents' phone?
I email it to them. It's in a PDF format. You can read it on your phone. You can print it out. It's fantastic. So you can make your own story, and you can actually go back and personalize it. So you can say, and you could even do it if you wanted to with the actual child and say, right, let's take a picture of you on the chair and we'll put that in the story. Okay. And it what it does is it makes them familiar. So kids are always scared of things that are new. Once something is familiar, it becomes much easier. So just knowing, familiarizing them with the steps that are needed to do something just makes it so much smoother when they come in. And even at the beginning of the appointment, I will summarize. I'll say, do you remember what we're going to do? It's really easy. We're going to put in the tooth pillows. Okay, not cotton wool rolls. We're going to put tooth pillows so your tooth can have a rest and keep it dry. We're going to wash your tooth with the blue shampoo, and then we're going to wash it and dry it and with the hoover, and then we're going to paint it to make it super strong, and we're going to put the blue tooth fairy light on it. And then that's it, we'll be finished. Now, some children like a challenge. So what I'll do is I'll say, usually it takes me 80 seconds to do each tooth. Do you think we could do it faster? Let's see how fast we can do it. And you get them to count in their head. And when you finished one tooth, you say, how long was that? And they'll say, oh, that was 76. Oh, I think we can do better. Let's do the next one. Let's see how long that one takes. So all the time they're distracted by the counting. They're excited because they want you to win. And another challenge I say is, oh, this is a competition. How many things can I fit into your mouth at once? Let's count. And while I'm doing the procedure, I'll be doing the steps, but at the same time going, oh my goodness, I've put a tooth pillow in, I've got my fingers in, I've got the hoover in. How many things is that? Let's count them. So all the time you're distracting, you're being playful, you're being fun with them, and they start to trust you. So building trust is really essential. Now, if a child was really, really anxious, actually, I wouldn't even start with fissure sealants. I would just put fluoride on. I would just do an appointment where I put fluoride on and I let them have a play with the chair. And then I said, well done, you were amazing. How cool is it coming here? Come back next time. We're going to make your tooth super strong.
But at that appointment, you can then, I'm assuming your protocol now with those nervous patients where you only place fluoride is you start that whole social story as well. You might take a photo of them. I mean, that is amazing. I think anyone who's serious in the world about using their own practice branding, their own selves, so the child is not nervous. So can you please tell us something? I'll put the link on for this app, but is it on like iPhone or iOS and Android?
I know it's on iPhone. It's on iPhone. To be able to use, to be able to make your own social story on it, it's like £14.99. It's a one-off payment. I paid it a few years ago, and I just find it
totally
invaluable.
worth it. I mean, that is. Okay, fair enough. Look, for NHS practice, look, I totally sympathize or empathize my fears, my peers, whereby they might find it difficult to make stories. But the odd opportunity you get, that's great. But in private practice, for those seeing children, this is a no-brainer. I mean, the amount of the wow factor in the parents, because they're going to be at home reinforcing, and then they're seeing your image and you treating other children.
They're helping you.
This is magical.
It's reinforcing the message that you're working together. And do you know what's even simpler than all of, like the simplest thing, even if you can't do a social story, even, you have restrictions, whatever. The first thing I do at a new patient assessment is to get the child into the chair. I take a Polaroid picture of them sitting in the chair.
Wow.
So I have a Polaroid camera. I'll take a picture of them sitting in the chair. Now they think, okay, it's just fun. Actually, that is them seeing themselves sitting in the chair, smiling, and they're going to take that picture home and they're going to look at it and they're going to be proud of it. They're going to show other people and they're going to feel like it is so normal for them to sit in that chair and smile.
That is
so it's just
powerful.
Reinforcing that behavior of it's you can sit in that dental chair. And I've had many anxious patients who, and at the beginning when they first come in for the appointment, I don't force them into the chair straight away. I get stuck in with my first question, which is the most important question ever. What's your favorite Disney movie? Right?
That's the most important question for sure. I love it.
Who doesn't have a favorite Disney movie?
What's your favorite Disney movie?
At the moment, it's Frozen 2. I'm not going to lie. Frozen 2.
I knew that. Toy Story is Disney, right? Toy Story?
Yeah. Well, DreamWorks, Pixar, all of these movies. So I say to them, what's your favorite movie? And that just breaks the ice. Okay.
Uh-huh.
So I'll talk about that a bit more in my tips for communication. I think we've sort of veered off course of what you do.
I'm going to have to make this into probably a 2-part episode. The first bit, let's make the first bit about managing the child and communication gems. So let's go with that. Yeah. And then the second part, I'll show you my clinical photo and let's talk about the nitty gritty about the local anesthetic or not, Hawk crowns, that sort of stuff. So if you tell me, I mean, is this a good point to talk about sugar bugs, or is that something common to later, or is that something you want to talk about?
So that's something I do in my assessment appointment. So I'll talk to them and I'll say, do you brush your teeth? So everybody asks that. Do you brush your teeth? Yes, I brush my teeth. Okay, how many times? Oh, maybe once. Yeah, I try for 2, and you ask the parents, do you help them with brushing? Because, we're trying to push supervised brushing. I think parents feel under pressure to give their child independence. So it's like, yes, they can put their coat on by themselves. Yes, they can dress themselves. Yes, they can feed themselves. Yes, they can brush their teeth by themselves. But actually, they don't. You have to make the parents understand that they're being misled because their child doesn't have the manual dexterity to do it. So I say, well, can you tie shoelaces? Yeah, I can tie shoelaces. Okay. But even I say to them, I'm a dentist and I brush my own daughter's teeth so I can see them really well. And I still miss places. I say to them, and this is my other tip for prevention and motivation, disclosing tablet. My God, I love disclosing tablet. And I think they're so underutilized, okay? And they're so cheap and they're just so easy to use. And it's something that you give the parent and you give the child and it's so visual. They can see exactly what they need to brush. And I say to them, and this is another part of the empathy side of it, I say to them, I'm a parent, I'm a dentist, I'm brushing my daughter's teeth. I give her a disclosing tablet to check that I have brushed her teeth properly. So you have to always make sure that you're not being judgy. Can't be a judgy dentist. Nobody likes a judgy. And children, and especially a parent about their child. I mean, you're a parent now. Jazz, and I think you can feel, you'll know that if anybody was to say anything about something you were doing for Ishan, I think you'd be very defensive, even if you don't mean to be. You can't help it.
Absolutely, every emotion is intensified 100-fold.
Exactly. Yeah, and not all of it makes sense, but there you go. That's parenthood.
So I share like a little personal thing. I mean, the other day we're doing the whole water babies thing, right? And I'm 30 now, and I've achieved some cool things in the past, and I've really enjoyed it. But the time that he was dipped underwater and he swam about 1 meter and he came back up, the proudest moment of my life. Everything else was irrelevant. That was the proudest moment of my life. So definitely, parenthood's been amazing. Which is why another reason why when I'm seeing child patients now, I'm always thinking, okay, this is someone's child. And what you said, communication is so important with these parents. You have to, like right at the beginning that you said, they should not feel any shame or blame. And everything you say has to have the right sort of touch to it.
Exactly. So when I'm talking to them, I say, okay, when you brush your teeth, you're brushing twice a day. Okay, do you know why you need to brush? And they say, well, clean your teeth. I'm like, yeah, but why? And this is when I introduce my sugar bug story, the sugar bug story. And I say to them, you've got these sugar bugs, they live in your mouth. And if they're a bit older, I'll say bacteria. Okay, I'll say bacteria, sugar bugs, just so that to make it feel a bit less intimidating, but also to acknowledge that if they're older, that it's bacteria. And I say to them, when you eat your food, so I say, these sugar bugs are living things like you. And when you eat your food, where does it go? And they kind of look at me in my tummy. Okay. And then where does it come out? And all children love potty humor. They like to hear about snots and poos and all of these things. And, I think from a young age, they think it's hilarious, even through to sort of teenage years. They're a bit
Do you ever
cringy,
get parents like raising their eyebrow and like thinking, why is my dentist talking about poo?
Yeah. Do you know what? I don't look at the parents at this point, but by the end, I've had so much feedback. From parents saying, after hearing that story, we've had no resistance to brushing, because you can't, it's like one of those things that you can't unsee. So I say to them, the sugar bugs, they do poos as well. And it's all over your teeth. And so every time you eat, they stick to your teeth. The more sugar you eat, the harder they stick and the bigger they get and the bigger poos they do. So we need to make sure that we are brushing twice a day to get them off your teeth, because those poos can make holes in your teeth. They make your teeth soft and they make holes in your teeth. So it's getting them to understand. And it's sort of, we're not fobbing them off just saying, brush your teeth. You have to give a reason. In this day and age, everybody wants to know why they're doing things. When you give them such a plain explanation, and like I said, they can't unsee it. I actually have a poop emoji on a stick that I have in the clinic, which I put in my big teeth. I show them a mouth with teeth with a poop emoji in it. That's it. You can't unsee it.
There's two reasons why that's so powerful. One is because it's the visual. You have the emoji in the mouth, but you've attached. It's not. Or you said explanation, but it's an amazing story. When you add a story to something, it becomes memorable. Yeah. And I think that's why you probably had so much success with this with children. And I think since you told me about it a few months ago, I've used it on a few children now. I'm still refining how I say it. I don't think I'll do it quite as well as you do, but this is what it's all about. You have to practice. And it's a good point mentioning, I suppose, that I'm fairly good with children, and I get that from parents. Oh, you're really good with children. They always want to come and see me. But I get it where they've seen someone else, and or the child and the parent have seen someone else, and it's usually a man who isn't able to relate to the child at their level. It's just not part of their personality. Just like talk in a high pitched tone and become a child. And I want you to at some point just give some tips about. If people are finding difficult to relate to children, but they're still seeing children, what can they do? And I mean, my best advice would be practice in the mirror. Practice with if you don't have children, practice with other children, because you need to be able to relate to children in a playful manner, like you've advocated.
Yeah, and the thing is, the more excited you sound, the more excited they get. The more. So if you're just like, sit in the chair, we're going to do this, and they're like, this is boring. They'll start to look for excuses to get up. They don't want to do what you're saying. But if you're really like, come on, let's go. Yeah, this is so fun. You're amazing. Look at this. Oh my goodness, I love your shoes. How fantastic. It's just picking up little things, and the tone of your voice is excited. They get excited. They're like, oh my God, I'm so lucky to be here. I'm so happy to be here. Look how happy she is. I must be happy too. Mm-hmm. So it's infectious. So that
it's contagious,
yeah. So that's what we want. So going back to my sugar bug story, this is when I bring in the disclosing tablets. Okay, so I'll say my sugar bug story. I'll say, this is why we need to brush to get all the poops off your teeth and the sugar bugs which are sticking there really hard. And of course, we don't want to feed them too much sugar because they just get bigger and hold on tighter to your teeth. They're stronger. And I say, and the thing about these sugar bugs and their poos is that they're camouflaged. And they are the same color as your teeth, so you can't see them. And that's why I give them the disclosing tablets and say, this is really fun. The first time you do it, you're going to chew it before you've brushed, and you're going to see all the places that you need to brush. And then after that, I turn to the parents and I say, after that, you're going to do it once or twice a week to check that the brushing is being done thoroughly. And the thing with the disclosing tablets that I use is that they're two-tone, so they will show up pinkish color for fresh plaque within 12 hours, and then the bits that are being missed more regularly, sort of all the time, they show up in a bluish purple. So I tell the parents that, and I say, and again, just making them feel that it's non-threatening, saying that I use them. I use them. It's not something that I'm giving you because you are not a good parent. You are not brushing your child's teeth well.
It's not a punishment. It's a routine thing.
It's a fun activity. It's really good for kids. And I say to them, it's good to motivate your kids to brush, because then they can see it visually, why they need to brush. They can actually see it. When they can't see it, it doesn't mean anything to them. When they see it in bright pink and they know that that's what they need to brush away, it just makes it more rewarding that they brushed it away. And also I find it's a really good tool for teenagers, because they kind of think, oh, my teeth look fine. But then when they can see it in bright pink, that's a different issue. I mean, with my own kids now who brush their own teeth, the older two, I sometimes will say, I'll hear them going to the bathroom to brush their teeth, and they'll go in for about 30 seconds, when they're trying to just, say that they've brushed their teeth, and they'll come out and I'll shout, did you brush your teeth? Yeah, brush my teeth. And I'll say, okay, then go chew disclosing tablet. I want to see exactly how well you brushed your teeth. So I think it's a very good parenting tool. That's what
Brilliant.
I would say.
My other thing is we give away these little timers, like the sand ones.
Yeah.
And children really respond well to that. What do you think about that?
They like those. I think everything with children is about it's about finding something new to motivate them. So at the moment, from my own experience, we will have that timer. We'll use it for a week. We'll use it for the second week. By the third week, it's forgotten. By the fourth week, it's sort of not exciting anymore. You need to always mix things up, which is why I say, getting a new toothbrush. So my daughter has an electric toothbrush, but occasionally if she sees a toothbrush she likes in the supermarket, which is manual, and she's like, oh, mommy, look at this, it's frozen. Look at this, it's Minions. Look at this, oh, I'm into dinosaurs at the moment. This is a dinosaur toothbrush. I'll buy it for her. It's a couple of pounds, but actually it'll motivate her for the next 2 or 3 weeks. She'll be excited to use that toothbrush. At the moment, there's other tools again, the disclosing tablets do act as a motivator. So that's why you use them sort of every now and then to motivate. There's things like I always recommend Brush DJ, which is an app, and it's free, and it won the best innovation award in dentistry because
that's been around for about 8 or 9 years. I mean, the guy was on Twitter. I used to I forget the guy who made the app, but I used to speak with him on Twitter about 9 years ago. So and that's been used by thousands of happy people.
Yeah, so that just plays music for them while they're brushing, and it's free, and it gives tips as well. And also for teenagers, it's good because it'll pop up reminders on their phone saying time to brush your teeth. And then that takes out, the element of the parent having to nag. And we all know, and I say to parents, we all know that the kids listen to their phone more than they listen to us. So if their phone tells them to brush their teeth, they're going to go and do it,
more
rather than going, have you brushed? Yeah, so that's another motivator. What I've just found this week, which I was really excited about, I think you might have seen my posts on Facebook about it, but there's a new toothpaste which changes color over the course of 2 minutes. So you start brushing, it's clear, it's got some little specks inside it, and then if you keep brushing over the period of 2 minutes, it changes to blue. So by the time they spit out, it's bright blue. And it's genius because you have to keep going. And that's what we want. We want them to be brushing for 2 minutes, because by 2 minutes, there's no, more or less you've made sure you've brushed well within 2 minutes.
Do you have a name of this toothpaste so that dentists can?
It's a Colgate. It's just the Colgate toothpaste, and it's aimed at, I think, 6 to 9 years. I might actually have a tube just here because I am going.
Yeah, amazing. That's really clever. I love that.
Yeah, here it is. So it's aimed at 6 to 9 years old. It's called Magic Toothpaste.
Toothpaste. Fantastic name.
Fantastic name. It isn't advertised very well. I think you'd have to look really carefully at the packaging to realize what it does. And I haven't
missed a trick here, because that is just phenomenal. That is just really, really good to get kids to brush for 2 minutes. Thing. Mm-hmm. Yeah. Well done.
So I got really excited when I saw this, and I bought a whole box of it. So I just went and took the whole box off the shelf, and I've been giving it to anyone who will listen. Here you go, have some Magic toothpaste. My kids loved it. I used it. It's fun,
Yeah.
And that's it. So it's all about changing it up. It's like, okay, for a while, me and my daughter were into, when Frozen first came out, we'd have a specific song that we'd brush along to, and it's just all about constantly keeping them motivated, which is exhausting, but that's what parenthood is about. I think you've realized repetition, Jazz.
Big time. So just to summarize the last bit, you said start off with a non-blaming culture, be really playful with all the ways, with the suction that you said. Social stories just sounds phenomenal. Get the child to count in the head 80 seconds, see if they can beat the time using something like a Polaroid picture. Nowadays you can get something called like a HD sprocket, which I got for my wife once, and it's like an on-the-go Bluetooth printer. So that's something like that could be used as long as you can make a photo, print a photo, and give it to the child. That's a genius. Obviously, using disclosing tablets, which are massively underutilized. Your sugar bug story has been phenomenal, and I think relating poo to the teeth is just as a story is just going to stick. Using the app Brush DJ and the Magic toothpaste. Is there anything else to wrap up communication, Libby? Because we could go on for days, but just to make it very impactful.
We could go on for days. I've made a couple of notes. So you said for like a dentist who's not really good at relating to kids. So when I first started pediatric dentistry, my kids were quite young, and so I didn't feel I was able to communicate with maybe the teenagers. And what I found is I just needed to find one topic that they like and learn a lot about it. So for example, when Fortnite became craze, I sat down somebody who likes Fortnite and said, tell me about Fortnite. And I just learned the key phrases that I would need to say to look as if I was into Fortnite. So I would say, do you play Fortnite? Yeah, play Fortnite. Oh, I've only won one battle royale. I have no idea what battle royale is, but I've learned that phrase. I have won one battle royale. How many have you won? And they'll go, 72. And I'll say, oh no, I just my tactic is when they throw you, I just hide where they land me and stay there until it's over, and that's how I won that one. But I'm not good at playing it, and I'm still on the first skin, which is like a purple bear or something. So it's just I have no idea.
The parents must be mortified. The parents must be absolutely mortified.
Oh, absolutely, absolutely. But do you know, it's just that icebreaker. It's that child feeling as if you know something that they know. It's like you've linked them. So even something as simple as putting a sticker on your tunic that day, so on your scrubs, put a superhero sticker on your scrubs. All children know the Avengers. All children know Peppa Pig, even if they don't like that character, Mickey Mouse, they all know these. It's something familiar. And once they start to connect you to something familiar, that immediately brings down the anxiety in that child. So and you should have a favorite movie. So like your homework as a dentist is to have one movie that you know so much about that you could sit there and talk to the child for 10 minutes about, oh, I love this film.
Toy Story, definitely Toy Story for me.
Yeah. So even if they don't like that movie, it's just about you having a favorite movie that is something child friendly that you can talk about and that they can kind of say, oh no, I really don't like it actually. Why not? Oh, this is my favorite character. Don't you like it when this happens? And it's just about, it's distracting them. It's making them feel comfortable because it's something familiar that they know about. So that's my tip for dentists. So just try and find something that, even if it's the same thing, and your nurse will get sick of you talking about the same thing each time.
True.
But it is just about making them feel comfortable. And if you're in private practice and you have the opportunity or the funds to be able to give them something other than a sticker, there's actually studies that have shown that, cooperation and everything improves when you give them a small prize. It doesn't even have to be something amazing, even like a bottle of bubbles or like a small bouncy ball or, a pencil, just something that is not a sticker. Because stickers these days, children aren't too fussed with them, to be honest.
Brilliant.
They like
good
it.
to know.
I mean, I have a sticker which is personalized and it says, I've been to see Dr. Libi today at the Berkeley Clinic. So for me, that's, reinforcing that, that they came to see me. And, I think it just helps them. It's a bit more personal than just a generic sticker. But at the same time, I give them a prize. So I have a treasure chest. And what I do is when I'm out, if I see something, on sale, pencils, whatever, even those sticker cards, which are like £1 a pack, football cards and frozen stickers and whatever you can pick up in the supermarket, and just having those on hand, it gives them that reward at the end of the appointment and it makes them feel good. And it does help them to come back because it's, at the end I get this treasure, to pick from. That's the last thing that stays in
I imagine
mind.
you actually have a brown treasure chest, do you?
It is.
Yeah. I expected no less from you, Libby. Let's have Dr. Libby's list, ultimate list for prevention. Shoot.
Okay, so tips for prevention. First thing, fluoride application. Always ask if they're having fluoride. I think in England they don't do it, but in Scotland they do it in schools. But apply fluoride. You have nothing to lose. If the parent is fine with having the fluoride on their child, every time you see them, every 6 months, put some fluoride on. When you put the fluoride on, make sure that you use a flosser to get it in between the contact. Okay? Because where do all the lesions start? Interproximally. We should be telling parents to floss their children's teeth. I don't know why it's not a normal thing, because that is where all the caries starts. So we need to be telling them to floss. That's the second one. Promote flossing, especially when you've got the 6 erupted, that contact point with the E, that's really important. Okay? Fissure seal. So now the guidelines have changed. You seal every 6. It doesn't matter if the child is high caries risk or low caries risk. You seal those 6s and you check those seals every time they come into you. Okay?
Can I just stop you on that one? So fissure seal in the 6s,
yeah.
Isn't there some evidence to suggest that fluoride varnish is just as efficient or efficacious? Is that the word? As doing a fissure sealant. So fluoride varnish, fissure sealant, there's no difference. Am I right?
Yeah. But now there's newer evidence to say that fissure sealant is actually superior. And that's why we have Scottish guidelines, so the SDCEP guidelines. And those guidelines changed in 2018 to reflect that new evidence and to say that we need to be sealing 6. We're going to seal all the 6s. And sometimes in a high risk child, so if I have a child who's had caries, and they have deep pits on their D's and E's, remaining ones that aren't caries, I will seal those as well. Because sealing is just so quick and easy, and it means that tooth is easier to clean, and it just gives the child a better chance. Okay, so fissure sealant. And also something really interesting. So when I went into school and I gave a talk to one of my daughter's classes, one of the mums sort of sent me a message later on with a picture of her daughter's tooth. It was a 6 and it had a pit on the palatal side. And she only discovered that pit because I had given her a disclosing tablet and she had chewed it. And the mum was looking at her teeth and said, why is there a pink dot on, that side of her tooth? And it was a palatal pit. So we need to be checking these 6s for palatal pits because if you seal them, then you've saved that tooth from developing caries, because even in the best oral hygiene, if you've got palatal, there's a high chance it will become caries just because it's a plaque trap. So ideally, if you can disclose a child's teeth and have a look at them yourself, that's pretty cool. And it's quite, you can use it as the motivation and, teaching experience for the child and parents. So I would actually recommend anybody who has any interest in treating children reads the SDCEP guidelines for caries management in children, because it gives a very comprehensive overview of what to do, and it really guides you so well, and it's got visual aids, pictures and things. It tells you how to speak to parents, how to motivate families. It's just a really great guide, and it's easy to read, and I think it's an invaluable tool.
Absolutely. And I'm going to put all these files, like the STDEP and also the Social Stories app, a link to the Social Stories app on my website, and also on the Protrusive Dental Community Facebook group. So that's amazing. Do you have any more of those prevention gems?
I think that's it really for prevention.
So let's wrap up. That was part one. Let's say that was part one, because there was so much to learn. I'm glad it went that direction with the communication gems, because I think that everyone will gain so much from that.
Thank you so much for listening all the way to the end. That's all we have time for this episode. The second episode will be out very soon. If you found this useful, or if you know someone who sees children and they may not enjoy it so much, or there are some aspects, clinical or communication aspects, which they struggle with, please do share this podcast episode with them as well as the next one. And I'll catch you then. Stay safe, stay well.